Genetics. When headaches run in the family. Let's start with something you were born with, your genes. Genetics simply means traits passed down from your parents that influence how your brain and blood vessels respond to pain. Think of it like inheriting the blueprint of a house. If the wiring in that blueprint is slightly faulty, the lights may flicker every now and then. Similarly, certain genes can make your brain more sensitive to triggers that cause headaches, especially migraines. Family history plays a big role. If your parents or siblings suffer from migraines, your risk increases significantly. Doctors often look at first-degree relatives because this is where the genetic link is strongest. Scientists see this clearly in identical twins. Since they share nearly identical DNA, if one twin experiences migraines, the other is likely to develop them too. But genes rarely act alone. Think of genetics like a loaded gun, while lifestyle pulls the trigger. Stress, poor sleep, hormonal changes, and diet can activate those inherited tendencies. Many migraine-related genes affect two major systems in the body: vascular and neuronal pathways. On the vascular side, variations in the MTHFR gene can raise levels of a molecule called homocysteine. High homocysteine can damage the inner lining of blood vessels and form blood clots, disrupting blood flow in the brain and causing migraines. Supplements like folic acid, vitamin B6, and vitamin B12 may help reduce attacks. Then there's the neuronal side. Many migraine sufferers have abnormally excitable brain cells. Imagine your brain switches being overly sensitive. Small triggers like bright lights or stress can set off a chain reaction of nerve signals that becomes a migraine. Therapies that activate the TRESC channel may help calm these overactive nerve cells. The scary part? You might carry these genetic tendencies your whole life without realizing it, until the right combination of stress, hormones, sleep changes, or diet suddenly flips the switch. Sleep disturbance. When your brain misses its nightly reset. Your brain runs on a schedule, a very strict one. It's called the sleep-wake cycle, the internal clock that decides when you sleep, when you wake, and how your brain repairs itself overnight. When that schedule gets disrupted, headaches often follow. Think of sleep like your brain's nightly cleaning crew. Every night, especially during deep sleep, your brain resets pain signals, balances hormones, and recovers from daily stress. But if deep sleep gets cut short, the cleanup never really happens. And here's where things get interesting. Studies on healthy volunteers show that when sleep time decreases, pain thresholds drop. In simple terms, your brain becomes more sensitive to pain. Small triggers that normally wouldn't bother you, bright lights, dehydration, or stress, can suddenly trigger a headache. The opposite is also true. When people get longer and deeper sleep, pain sensitivity decreases. Another important player is melatonin, the hormone that regulates your sleep cycle. Disturbances in melatonin release, often caused by irregular sleep or late-night screen exposure, can trigger headaches and increase anxiety and stress vulnerability. The good news? Regular sleep schedules, stress reduction, and treating anxiety or depression can significantly reduce headache frequency. Stress. When your brain stays stuck in tension mode, stress is one of the most common headache triggers, and the result is often something called a tension headache. This type of headache feels exactly like its name suggests. Imagine a tight band wrapped around your head, slowly squeezing your forehead and temples. Think of your muscles like rubber bands. When you're stressed, those bands tighten, especially in your neck, scalp, and shoulders. Normally, they relax again once the stress passes. But when stress lingers all day, those muscles stay tight for hours, creating constant pressure around the head. That pressure irritates nearby nerves and reduces blood flow to surrounding muscles. The result is the dull, aching pain many people recognize as a tension headache, and this isn't rare. More than 70% of people experience episodic tension headaches at some point in their lives. Long hours staring at screens can add eye strain, poor posture can cause neck strain, and conditions like degenerative arthritis in the neck can worsen the tension. Mental stress plays a role too. Anxiety and depression can keep the body stuck in a constant stress response, tightening muscles without you even noticing. The good news is that tension headaches are often manageable. Over-the-counter pain relievers, along with stress reduction, better posture, and regular breaks, can help relax those overworked muscles. Alcohol intake. When a drink turns into a headache, alcohol is considered one of the most reliable dietary triggers for headaches, especially migraines. It doesn't sneak up quietly. It makes its presence felt, sometimes hours later, in the form of a pounding head. Cultural habits play a role too. How much, how often, and what type of alcohol people drink can affect who gets triggered and who gets lucky. Think of alcohol like a mischievous bartender inside your body, pouring a drink that relaxes your blood vessels a little too much. This vasodilator effect hits both peripheral and central pain receptors, setting off the same kind of chain reaction that other strong vasodilators, like histamine, CGRP, and glycerol trinitrate, GTN, do. Blood vessels expand, nerves fire, and suddenly your brain feels like it's under pressure from the inside out. Women are generally more susceptible, showing a stronger predisposition to alcohol-triggered headaches, likely due to hormonal and vascular differences. And don't forget the hangover headache, which is essentially a delayed encore. Dehydration, inflammation, and chemical byproducts all team up to remind you of last night's fun. The good news? Understanding your triggers, limiting intake, staying hydrated, and avoiding known headache-inducing drinks can help prevent these alcohol-fueled attacks. Sometimes the simplest solution is knowing when to say no before your brain says yes to pain. Cerebral venous thrombosis. Blood clots in the brain. Blood clots in the brain are sneaky troublemakers. They often start quietly, but one day your head lets you know something is wrong. The most common warning sign? A headache that refuses to quit. It usually worsens when you lie down or strain, like during coughing, sneezing, or a Valsalva maneuver. Think of your brain's veins like a busy highway system. When a clot forms, it's like a traffic jam blocking one of the main routes. Blood can't flow properly, pressure builds up, and the vessels start stretching. That stretching irritates nerve fibers, which your brain interprets as pain. In some cases, inflammation occurs inside the veins themselves. Proteins and fluid leak into surrounding tissue, amplifying the headache and sometimes causing pain on both sides of the head. Certain factors increase risk, like oral contraceptive use or clots in the lateral sinus extending to the jugular vein. These conditions can set off a chain reaction, turning a simple headache into a serious medical emergency. The exact mechanism isn't fully understood. Early detection is crucial. Treatment often involves blood thinners and monitoring, and quick intervention can prevent further complications. In other words, your veins may start a fight, but medicine can help restore order before it's too late. Aneurysm. When your brain's blood vessels balloon out of control, an aneurysm is like a weak spot in a garden hose. Over time, the pressure of blood flowing through your arteries pushes on that weak spot, creating a tiny bulge, a ballooning in your brain's blood vessels. Most aneurysms form at branching points, where the vessel walls are naturally under more stress. Sometimes, people are born with a brain aneurysm, a hidden ticking time bomb lying in wait. Most of the time, aneurysms stay quiet. But if that weak spot ruptures, the consequences are dramatic. The bleeding floods the subarachnoid space around the brain, causing what doctors call the worst headache of your life. It can trigger a hemorrhagic stroke, damaging brain tissue in minutes and setting off a cascade of neurological symptoms. High blood pressure is the usual culprit that turns a dormant aneurysm into a disaster. Think of it like cranking up the water pressure in a worn-out hose. Eventually, it bursts. Other factors like smoking, trauma, or connective tissue disorders can add fuel to the fire. Early detection is key. Imaging tests like CT scans, or MRIs, can reveal aneurysms before they rupture, allowing neurosurgeons to intervene with clips or coils to prevent catastrophe. Protecting your vessels through blood pressure control, avoiding smoking, and monitoring risk factors is like reinforcing the weak spots in your garden hose before it blows. Because once it ruptures, every second counts. Meningitis and encephalitis. When your brain and spinal cord get under attack, meningitis is like your brain's security system going haywire. The meninges, the protective membranes around your brain and spinal cord, become inflamed, and suddenly the fluid that cushions your brain feels more like a pressure cooker. Most often viruses are the culprits, but sometimes bacteria sneak in, either through the bloodstream or directly from an ear infection, sinus infection, or even a skull fracture. Once inside, these germs trigger inflammation, swelling, and pain, turning your head into a literal battlefield. Encephalitis takes it one step further. Here, the brain itself becomes inflamed. Viruses or bacteria can directly invade, but sometimes your immune system mistakenly attacks your own brain, like friendly fire gone horribly wrong. The result is swelling that can cause headaches, confusion, seizures, or even more severe neurological damage. Think of it like a water balloon under pressure. The membranes and brain tissue are soft, delicate, and normally flexible. Infection causes swelling and stiffness, nerves get irritated, signals misfire, and your body starts sounding alarms in the form of fever, headache, or neck stiffness. Medical intervention, antibiotics, antivirals, or supportive care can prevent serious damage. Vaccines, hygiene, and avoiding exposure to sick individuals are your best defenses. Dehydration. When your brain shrinks and screams for water, dehydration happens when your body isn't getting enough fluids. At first, it feels harmless, but soon your head starts sending urgent distress signals. The headache can be all over or in one spot, front, back, or side, and it might feel like a dull throb or even a sharp stabbing pain. Move too quickly, bend over, or shake your head, and suddenly the ache intensifies like your brain is playing a cruel game of tug-of-war. Here's why it hurts. When you're dehydrated, your brain and tissues shrink slightly, pulling away from your skull. That tug stretches and irritates the surrounding nerves, which is exactly the pain you feel pounding in your head. It's your brain literally telling you, hey, I need water. Heat, sun exposure, or intense exercise can make things worse, sometimes escalating into heat exhaustion, where your whole body feels off and your headache refuses to quit. The good news, your brain is forgiving. Drink water and other fluids, and it gradually returns to its normal size. Think of dehydration like a deflating balloon inside your skull. Ignore it, and the tug of war continues. Pay attention, hydrate consistently, and your body and your brain thank you.